Warm greetings from the High 10. It is Everyday Shenanigans on this Wednesday, Hump Day, May 6, 2020. I'd like to bring you said information out of New York City. And this is brought to you by CBSNews.com. 15 children hospitalized in New York City with rare condition that could be linked to COVID-19. And there's also a video in this said commentary, and it has an editor's note. Health officials in New York City released new data Wednesday. 15 children between the ages of 2 and 15 have been hospitalized in New York City with symptoms consistent with a rare disease possibly linked to the coronavirus. Health officials said the illness has features of Kawasaki disease, a serious illness first noted in children with COVID-19 in the United Kingdom. A pediatric multi-system inflammatory syndrome recently reported by authorities in the United Kingdom is also being observed among children and young adults in New York City and elsewhere in the United States, said Dr. Dimitri Daskalaskis, Deputy Commissioner of the New York City Health Department's Division of Disease Control, in a public letter to colleagues Monday. According to Daskalaskis, symptoms vary among the children depending on which organ system is affected, but include features of Kawasaki disease or features of shock. All of the children experienced a persistent fever. More than half reported rash, abdominal pain, vomiting, or diarrhea, and less than half experienced respiratory symptoms. He added, however, that the full spectrum of disease is not yet known. Kawasaki disease is associated with fever, skin rashes, swelling of glands, and in severe cases, it can inflame blood vessels within the heart. Dr. Diane Hayes, a pediatrician in New York City, told CBS News last week that she was not surprised by the UK report showing a possible link between COVID-19 and Kawasaki. According to Hayes, children can sometimes develop the disease after a bout with a common cold, which is caused by a different variety of bug in the coronavirus family. Coronavirus can become very severe in kids, despite most showing milder symptoms, which we've seen that with COVID-19 in adults. She added that Kawasaki could pop up weeks to months later after experiencing some kind of viral infection or multiple viral infections. The cases reported in New York involved children who were hospitalized between April 17th and May 1st with illness compatible with the form of Kawasaki or shock. According to the New York City Health Department, more than half of the children required blood pressure support and 5 required mechanical ventilation. Those who were admitted to pediatric intensive care units required cardiac and or respiratory support, according to the health department. None of the children have died. Amen. 4 of the 15 children tested positive for the coronavirus. 10 came back negative, and 1 was initially indeterminate and then negative. Serology testing showed that 6 patients with negative results had coronavirus antibodies in their blood, suggesting they had been infected earlier. Regardless of a coronavirus test result, the health department has urged doctors with patients under 21 years old and symptoms consistent with Kawasaki to immediately report those suspected cases to the health department. Doctors are also instructed to immediately refer such patients to a specialist in pediatric infectious disease, rheumatology, and or critical care. Only severe cases may have been recognized so far, according to the health department. Daskalaskis wrote that earlier diagnosis and treatment of patients meeting full or partial criteria for Kawasaki disease is critical to preventing in-organ damage and other long-term complications. So, early diagnosis is to prevent in-organ damage or long-term complications. And this was brought to you by CBSNews.com. So, 4 of 15 children have tested positive for the coronavirus in New York. 10 came back negative, and 1 was determined indeterminate and then negative. But serology testing shows 6 patients with negative results had the coronavirus antibodies. So please stay aware of this new disease that is linked to it's showing signs of a disease called Kawasaki, which is in this corona family, So I guess that's why we have the name COVID-19. It happened in 19, and then it is a coronavirus. It's like whatever the hell that means. But this is what I'm saying. Yes, we need to be open at some point. When, I do not know. Are we antsy, tired of sitting around, fearful? Some are not fearful, some don't care. But look at the end result. Places have started to open up May 1st, the end of April. And now we have a disease called Kawasaki that has been found in the United Kingdom in children, I guess in some adults as well. And now 15 children have become ill in New York City. Luckily, none have perished, but have needed ventilating support to stay alive. So you see, as I've stated before, no one knows about this disease because it is new. And we have specialists who are proficient in this area. So I would trust their judgment before I would trust a man who knows nothing about medicine. And I am speaking of Mr. Trump. I will believe in what a specialist has to say. Someone who has studied viruses and infectious diseases, such as Mr. Fauci, or any other reliable source who has studied medicine and diseases. And as you see, this disease is doing her own thing. And now you have this Kawasaki disease that they believe is what is causing these children to be ill and have respiratory problems and other ailments, fever. It is sad. So worrying about COVID-19 was one thing. Worrying about it mutating was another. And now here comes this, which I don't know really what a mutation is, to tell you the truth. I haven't done any research. Maybe I should come back with a video on that. But this is not good. And as we start to mingle again, as Mr. Trump has told us, there will be some deaths. Yes, there will be some deaths. That's quite obvious. But as they say, what is the price for going back into work, mingling, games, bar mitzvahs, weddings, functions, sporting events, outdoor events? The possibility of death. Praying for these children, praying for those who have been sick with COVID-19, praying for those who have recovered that they do not get COVID-19 again, and praying for those who have lost their lives to COVID-19. And praying for those who have commented on the channel who have lost their loved ones. One commenter has lost her father and one commenter has lost her husband. So prayers for them. I don't know what to say. This was the video I was dreading. The information I was dreading is that we would find out there was something else that has come out as a disease pertaining to COVID-19. And here is her brother, Kawasaki. Like, share, subscribe, drop your comments below. Thanks for joining me on this chilly evening in the high 10. You all stay safe out there. Wear your mask and gloves. Please keep your social distance from others. Be safe. Mask up, gloved up. Put the appropriate items in the appropriate receptacles when you are done using them. And be safe, America. God bless all of you. Praying for all of you. Please pray for me. This is a journey. This is one hell of a journey. God bless America. Thanks a lot. And this is Everyday Shenanigans. Good night.